Hello everyone! Today, we're on a journey to explore the hyperthyroidism, an intricate health condition that affects millions worldwide. Join us as we delve into the general aspects of the disease, its underlying causes, the chemistry involved, the diagnosis, signs and symptoms, the treatments, and much more. First, our thyroid gland is a butterfly-shaped organ situated in front of our neck. It is a vital player in the endocrine system. Its primary function is to produce and release the thyroid hormones, which is the T3 and T4, into our bloodstream. These hormones are essential regulators for metabolism, influencing how the body uses energy derived from food. Under normal circumstances, the production of thyroid hormones is intricately regulated by our feedback systems involving the hypothalamus, the pituitary gland, and the thyroid gland. Our hypothalamus releases thyrotropin releasing hormones, or the TRH, which signals the pituitary gland to produce thyroid stimulating hormones. Our TSH is in turn prompts the thyroid glands to release the T4 and T3. And as the levels of hormones rise, they signal the hypothalamus and our pituitary gland to adjust their hormone production, maintaining the delicate balance. And in the case of hyperthyroidism, this delicate balance is disrupted. So our hyperthyroidism occurs when the thyroid gland goes into overdrive, producing an excess of thyroid hormones, the thyroxine or the T4, and the triiodine threonine or the T3. And these hormones plays a crucial role in regulating our metabolism, affecting our energy levels, heart rate, and our body temperature.
Understanding how hyperthyroidism is acquired is crucial. While it can be caused by conditions such as Graves' disease, nodules, or thyroiditis, so let's define them one by one. First is Graves' disease. For children, this is the most typical cause of hyperthyroidism. The thyroid gland becomes hyperactive as a result of antibodies the body manufactures. While antibodies typically aid in the body's defense against illness, they also prevent the thyroid gland from being properly controlled by the body. Thyroid hormone levels in the blood can rise significantly as a result. So the second one is thyroid gland inflammation or thyroiditis. The thyroid gland releases excessive amounts of thyroid hormone into the blood as a result. Numerous factors, including injuries to the thyroid gland, infections, and autoimmune illnesses, can result in thyroiditis. Thyroiditis-related hyperthyroidism often resolves on its own within a few months. Thyroid injury can sometimes be repaired, but it seldom prevents the thyroid from functioning correctly. And last but not the least is thyroid nodules, or growth in the thyroid gland. This can occasionally produce excessive levels of thyroid hormones, which can result in hyperthyroidism symptoms. Overactive thyroid nodules can be felt in the neck and are typically large, measuring an inch or more. It's also important to explore the genetic aspect. In some cases, there's a hereditary link. We'll unravel the genetics behind this disorder, exploring how it can be passed down too.
Hyperthyroidism and overactive thyroid condition exhibit distinct signs. Unexplained weight loss, despite an increased appetite, stems from the heightened metabolic rate. Warm skin and excessive sweating result from surplus thyroid hormones, generating extra heat. Patchy hair loss and fine tremors in the hand or fingers are commonly manifestations, underscoring the condition's impact on physical and neurological aspects. Recognizing these symptoms is crucial for timely intervention and effective management of hyperthyroidism. As we conclude our exploration, hyperthyroidism emerges not as an insurmountable challenge, but a condition that can be understood and managed by shedding light on its general aspect, causes, genetics, signs, and treatment options. We hope to empower individuals to navigate their health journey more confidently. Before we wrap up, let's summarize the key takeaways. Hyperthyroidism involves an overactive thyroid with causes ranging from autoimmune disorders to genetic factors. Recognizing symptoms early is crucial, leading to accurate diagnosis and tailored treatment plans. Patient care plays a vital role, emphasizing the importance of collaboration between individuals and healthcare professionals for optimal outcomes.
Hello everyone, I'm Jan Caleb Lidasa and I'm here to discuss the signs and symptoms of hyperthyroidism. So recognizing the signs and symptoms is key to early detection. Hyperthyroidism often manifests with weight loss, rapid heartbeat, anxiety, tremors, difficulty sleeping, and sensitivity to heat. By understanding these signals, individuals can seek timely medical attention.
Moving into the diagnostic realm, we'll explore how healthcare professionals identify hyperthyroidism. This typically involves a detailed medical history, a thorough physical examination, and a specific blood test to measure levels of T3, T4, and thyroid-stimulating hormone. Thyroid scan, radioactive iodine uptake scan. This can check if your thyroid is overactive by measuring how much iodine it takes you from your bloodstream. Ultrasound of thyroid. This is to measure the size of the entire thyroid gland. And lastly, the CT or MRI scans. This is to show if the pituitary tumor is present. Together, these pieces of the puzzle provide a comprehensive picture.
Once diagnosed, various treatment options come into play. We'll discuss the use of anti-thyroid medications, radioactive iodine therapy, and in some cases, surgical interventions. Each approach aims to restore hormonal balance and alleviate the symptoms associated with the hyperthyroidism. Now let's dive deeper into the treatment options for hyperthyroidism. First, we have the anti-thyroid medications. These medications, such as metimazole or profiltyrosol, work by inhibiting the production of thyroid hormones. They help to restore hormonal balance and reduce the symptoms of hyperthyroidism. Regular monitoring of thyroid function is necessary while on these medications. Next, we have the radioactive iodine therapy. This treatment involves the administration of a radioactive form of iodine, either as a pill or liquid. The radioactive iodine is selectively taken up by the overactive thyroid cells, destroying them over time. It is a non-invasive and effective treatment option, but it may result in temporary or permanent hyperthyroidism in some cases. Last but not the least is the surgical interventions. In certain cases, surgical removal of all parts of the thyroid gland may be recommended. This option is typically considered when anti-thyroid medications and radioactive iodine therapy are not suitable or have not been effective. Thyroidectomy can help restore normal thyroid hormone levels, but it requires lifelong hormone replacement therapy afterward.
So let me discuss the hyperthyroidism patient care. Patient care is a vital aspect of managing the hyperthyroidism. Well, delve into the individuals can actively participate in their well-being, from adhering to medication regimens to adapting lifestyle changes that support thyroid health. Education and collaboration between patients and healthcare providers are paramount. So, hyperthyroidism care involves addressing symptoms, and it includes rapid heart rate, anxiety, and weight loss. So, the treatment option may involve anti-thyroid drugs, radioactive iodine, therapy, or surgery. Regular monitoring of thyroid hormone level is a must. Emotional support should be offered alongside educating patients about their conditions, as well as encouraging a balanced lifestyle as part of comprehensive care. Collaboration with the endocrinologist and regular follow-ups contribute to effective management.